family. So I'm a clinical psychologist, and I did my graduate work in an area of clinical psychology called health psychology, which is the side of clinical psych that's devoted to helping people with medical conditions. I guess you can all imagine how I happened to go into that area. And so in my work, I ended up specializing in, I really wanted to work with people who have chronic illness, so I ended up working with people who have diabetes. So that's where I devote all of my professional life, is to helping people who have diabetes. And so I deal with the psychological side of things. I specialize even further, and I do a lot of treatment of depression and helping people who have pretty severe disabilities related to complications from diabetes. And so basically all of my days are covered with talking about chronic illness, how to cope better with it, how to live better with it. And it's very comfortable for me because I'm talking about a disease I don't have. And so when I come here, it's really strange because I have to, I'm talking about my own stuff, and so it's very different than what I do normally professionally. It's much more emotional for me because I'm not practiced at this, other than what I do with my own family. This is it's a little bit more raw than what I would normally do, because I'm going to share with you what's been hard for me and what's been hard for my family members. So that's my brief bio. Oops. So I have to represent. So I'm from San Diego. I originally grew up in Buffalo, and once you live in San Diego, it's really hard to live anywhere else. So I remain a San Diegan. So we have the zoo. There's La Jolla there, downtown San Diego. It's really a lovely place to visit if you get the chance. This is my family. There's actually a few more members than are pictured here now. My son, who's on the far left of the screen there, is now 18, so this was, I think, 4 years ago. And the people who are in blue circles are all of the people in my family who have Nail Patella Syndrome. So my father, who's in the middle there, was a sporadic mutation, so he was the first one in our family to have it, and he didn't know it was a genetic disorder because until, being sporadic, you don't necessarily know. Until I was born, and they actually didn't, they thought I was just a pretty ornery baby that didn't want to put clothes on because I refused to put my arms in the sleeves. And so it wasn't until maybe I was 3 months old where my grandmother was trying to put a dress on me, and she said, she has George's arms. And that's sort of how it got left. That I had my dad's arms. And it wasn't until I was about 12 years old and starting to go through puberty that things kind of started falling apart for me. So I shut my locker door and my shoulder dislocated. I didn't have any dramatic story. Some of my worst dislocations have been things like rolling over in bed. It's like, I like to say it was, something else going on in bed, but no, it was really just rolling over in bed. And so it's just some of my dislocations have been so non-traumatic that I felt really freakish. Like shutting my locker door shouldn't dislocate a shoulder. And a lot of doctors, when they would look at me, they would be afraid to touch me. Like they'd see the X-ray of whatever, and they didn't really want to do anything except prescribe pain pills. And it wasn't until someone had the brilliant idea, which really, genuinely, it was brilliant. They referred us to a geneticist. And he listened to our symptoms. He took one look at my thumbnails and he said, I know what this is, I'll be right back. And so he diagnosed us that day. I have a little brother at the time who has it too. And so when I was 12 years old, I finally got the diagnosis, Nail Patella Syndrome. That was when my father found out. That's when my brother found out. And that was also the day I found out I had kidney disease. A little bonus. And since then, my dad had remarried and had 2 more girls who also have Nail Patella Syndrome. And Melanie is my youngest sister, 19 years, my junior. So my dad had 5 kids, 4 of us got it. And so when I talk to you about what's hard about Nail Patella Syndrome, it's not going to be based on any lovely study on all of you that really have shared that with me. I would much rather report, what we know to be true rather than my own conjecture, but I'll just tell you what I've heard from many of you about what's hard and what's been hard for us. and some strategies. And that's where the strategies for living well really come from my work with people who have chronic illness and disability, and really what's worked for me. I'd like to have time for discussion, but I tried to cut out some slides. I think I have like 45 of them, and so I might have to fly through some of the material. So what's hard about Nail Patella Syndrome? For me, one of the hardest things is just having a rare disorder. I get really sick and tired of nobody knowing what it is. You know, sometimes feeling different or weird, quite frankly. You know, and you can be weird to, you know, pretty much anybody who doesn't have Nail Patella Syndrome, right? To most of the medical community, I have to tell you, it's one of the emotional things for me about coming here is having this lovely group of physicians who give a damn, right? And who actually take an interest, and who are curious enough to want to dig deeper. And some of them don't even have a personal connection, like Dr. Lemley, the nephrologist who spoke with us. You know, I think, you know, for some of the people who have a kid with Nail Patella Syndrome, you can understand why they take their time to be here with all of us. So I just want to thank all of you who have so generously, you know, given to our community. Yeah, really. And there, you know, differences between us. So I have kidney disease, and I'm the only one of the children who got kidney disease. So it's, you know, so sometimes we can even be weird within our own family. You know, some of us have different symptoms and so on. And this is the easy one, frustrations of being a patient in general. You know, having to educate your MDs and hoping that they take an interest. Having a healthcare professional who will listen. I have found that's the hardest thing for me, especially when my son had his first dislocation when he was on a class trip in New Zealand. So he calls me from whatever it was, 6,000 miles away, and says, Mom, what does it mean when your knee like goes on the other side of your leg? And I'm like, oh no, you know. And what was sad is that, you know, no one there took an interest. You know, he actually limped himself to like a gas station store and found an ACE bandage that he wrapped around his leg, and that's how he managed for the rest of his vacation there. And, you know, there was a lot he couldn't do. You know, they had 2-mile hikes planned and things like that, and he basically sat in the youth hostel. But, you know, just that idea of, like, the frustration of nobody getting it. You know, I think that's really hard for a lot of us. And for me, I always hope for, because I don't really have any hopes that a doctor is going to have heard of it before. What I really hope for is someone to be curious enough to give me their best guess. You know, their best guess is my best hope, you know, and that's really all I ask for. But that's really hard sometimes, to get someone that you can even feel confident trusting their best guess. Living with chronic pain, and I don't know about all of you, but my pain moves around. So yeah, I may have shoulder pain that lasts for 6 months, and then it resolves on its own, and next thing I know, my knee hurts. Or right now I'm having tailbone problems. They don't know what that's about. I haven't had any solutions. And it's really disabling for me because I'm a psychologist. I sit for most of my day. And by the end of the day, I can hardly stand it. And the thought of sitting in traffic to drive home has almost moves me to tears. So the pain moves around, and sometimes it can be really limiting. And sometimes pain is from surgeries, or maybe surgeries that didn't go well. Or maybe you're recovering from surgeries, or maybe you have scar tissue that you have pain from. I mean, pain with Nail Patella Syndrome, with physical pain, can really be, I think, very varied, you know, and it can really, you might have something that affects you for a long period of time, and then for some reason it resolves and you don't have it anymore. And it's I don't know, it's a mystery to me anyway. And I have found that a lot of times when you're working with people who have chronic illness, it's kind of where we think things might go that can become really disabling. Worry, you know, fear the future. You know, if this is what my body's like at 44, what am I going to be like when I'm older? You know, so the coping with uncertainty and that feeling of helplessness, that no matter what I do, it doesn't really seem to have an effect. Sometimes I've tried treatments that are supposed to work, and they don't, you know, or they say, oh, that won't help, and it does. And so sometimes it's really hard to have a sense of what you do actually matters. And the uncertainty of that, you don't know what the course of your disease is going to look like. And I'm always hopeful. My dad's 75 now. Nail Patella Syndrome, also has chronic kidney disease. I think, well, hopefully it'll go as well as my dad did. And so that's what I hope for. But that's not necessarily the case, right? As it has been already pointed out, we're special. We're like snowflakes, right? We're all unique and different. And so we can't necessarily base how our course of our Nail Patella Syndrome is going to go based on how our family members go. So that feeling of uncertainty can be really scary, especially for those of us who have kidney disease. And also the idea of passing it on. Now, I'm done having children now, but when I was at that age, that was really very much on my mind. And I did pass it on to my son. So my son is 18 now, and he doesn't mind that I use this picture. When I used it, I didn't tell him why I used it, but so this is Evan when he was, I think, 8 years old. And so when I showed this picture for the first time, it probably made me cry when I did it, so when he was actually that age. But I showed this when I went to the Nail Patella conference in England, and I had 2 or 3 men get up and leave the room. And they said, "I'm sorry, Susan, I had to leave your talk, but this affected me a lot." And the idea of how our society defines body image, sometimes, and I think it's kind of interesting, on this magazine cover we have something for both the men and the women. So for men, a lot of how we define being manly has to do with muscular development, and a lot of people with Nail Patella Syndrome have small upper bodies, right? Maybe my son doesn't have any triceps, and that's hard. He's about 5'9" now, and he's 105 pounds, so he's skinny, and he looks like an adult version of that, actually. And so, and then for the women, get a huge chest. So, a lot of times, and so for those of you who it's not something that Ian screams out when he's talking about the symptoms of Nail Patella Syndrome, but a lot of us women tend to have underdeveloped breasts. And so, yay, right? So that's hard. So in addition to having no triceps, small boobs for us women, not everyone. There's a few lucky people, but yeah, that's right. But the body image is what I wanted to talk about. And so body image is the view from the inside, okay? So it isn't necessarily reflected in reality, although it may have a reality-based component. So my brother, who's actually probably one of the tallest people with Nail Patella Syndrome, he's 6'3", and very skinny as well. And he's still harassed about how skinny he is and how small his arms are. And he's in his 40s. But people find it very comfortable to say to him, you should work out and squeeze his arms. Like, oh, gee, that never occurred to me, I'm glad you said that. And I don't know why it's socially acceptable to comment on someone's weight when they're skinny, but it is. So someone would say, maybe you should gain some weight. And he said, well, maybe you should lose some. And then he was being rude, right? So so body image stuff it doesn't come from nowhere. It's often societally defined, but how much are you going to buy in is the part that you get to decide. But it's an important risk factor for depression. So if you're really unhappy with the house that you live in, your body, it's a lot harder. It's a lot harder to feel at ease with yourself. And it's actually your body image is a significant aspect of a person's identity. And you can notice that as those of us have aged, with Nail Patella Syndrome, when you were in your 20s and 30s, things maybe mattered more to you than when you're in your 40s and 50s. Your identity shifts. But when you're a teenager, some of these things are really important. And your willingness to engage in relationships. And I've heard some sad stories in these conferences about sometimes people were unwilling to engage in sexual relationships or dating, or it became very scary for them because they didn't want the person to see them naked or see their scars, or they didn't feel manly enough. This is actually a self-portrait that my brother is an artist, and I had been looking through his sketchbooks when he was in college, at art school, and this was one of his self-portraits. And so this is how he saw himself. He says, I kind of think of this one, I would have titled it The Crooked Man. So, you know, he could see he doesn't have a tricep, and you could see that his bones are kind of sticking out. And what you might not notice until you look is that he's got a tear rolling down his cheek. And this is sort of him standing in front of the mirror. You have to look twice. That's actually the faucet. That's not anything inappropriate. So, feeling stigmatized and social problems. So feeling stigmatized is feeling like you are treated differently because of something that people can see. That's what feeling stigmatized mean. And what happens is if you think that people are noticing your bent arm or your scars or your waddle, as I have, you can start anticipating how people are going to react, right? And usually it doesn't mean that you're going to anticipate them being positive, right? So you're anticipating rejection. It may lead you to feelings of being flawed or broken. You may become more sensitive to the opinion of others. You know, what other people think of you matters more. And you may feel a lot of guilt and shame. Something that I hear a lot about, both that we've talked about in my own family and I've talked about with some of you, is if your nail patella is subtle enough, you think about trying to pass. Like you don't want to tell people you have something wrong with you. And then versus coming out and just being open with it. And this can be things like, whoops. I thought that was my next slide. It could be things like making sure you wear lots of layers to cover those arms up, right? Versus go ahead and wear the short sleeve shirt. So I was telling the Zareskis that my son Evan, being as skinny as he is and not having triceps, he gets a lot of comments. And one of the things that really hurts my heart for him, and it's really, for him, psychologically, it's been probably the hardest thing for him is being skinny, is that he gets told a lot at school. He's a nice-looking kid. He gets told, you know, Evan, you'd be hot if you weren't so skinny. He gets told that so often. They've even put it on Facebook, you know, Evan, why don't you gain some weight? And he's actually trying now, and it's really sad. He hasn't, like, gained a pound, and he's, like, eating all kinds of crap. I have to, like, look away. But he said, I wore a short-sleeved shirt, Mom, one time to school, and I counted, I had 15 comments in one day about my skinny arms. And he says, but I had this idea that maybe they're commenting because they're not used to seeing them. They don't know. They don't know. And so once they've seen it enough, what's to comment on, you know? They've already seen it. And so he wore a short-sleeved shirt for a number of days in a row to see if the comments would go down. He counted comments. He approached it like a scientist. And actually, it worked. By him wearing the short-sleeved shirt, people got used to seeing his skinny arms, and it became no big deal. But the big deal was for him. And he realized, I have some control in that. So again, that's that competing with that feeling of helplessness. When you feel like you can do something about it, even if it's just, I'm going to wear a short-sleeved shirt and feel like I'm empowered now, that's doing something. So this is what my brother had said, this was when I asked him to tell me about this part of the self-portrait collection that he'd done. He said, I felt really alone with Nail Patella. He was picked on a lot in high school, bullied. And he said, I always saw like the regular boys they would connect, and I sort of felt like I was left out. I wasn't particularly athletic. He was an artist, and he said, that's what I was good at. And it's not like you socialize as men around artwork, and so that was hard. So depression is, again, something I specialize in, and I have to put a little asterisk by that because, Ian, in some of his, fascinating research, it looks like maybe there's a connection with serotonin, which is one of the brain chemicals that has to do with depression. It also has to do with a lot of other things, like I'm assuming Ian has explained, like the gut and sleep regulation and all kinds of other stuff that we may have trouble with related to serotonin. Depression is one of those things. Now, the other thing is, life with Nail Patella Syndrome is hard. So there may be a psychosocial component of why people with Nail Patella Syndrome may be at more risk for depression. So there may be a biological component, the serotonin part. There may be a psychosocial piece. Living with Nail Patella Syndrome can be hard. And, when we look at other disease groups, whether it's diabetes or kidney failure or heart disease, there's pretty much an even number across those diseases for risk of depression. It's about 20%. So if it's not more than 20%, I would wonder if there is so much of a biological component. And so we don't know because the studies haven't really been done. They've been too small. So what is depression? So it's a biopsychosocial illness. So it has biological components, it has psychological components, and it has social components. And we know that it affects your brain chemistry or neurotransmitters. And it affects how you process information, and I'll explain a little bit more about that. But actually, it affects what you notice in your environment, what you store, and what you remember. It changes how you think, and therefore it changes how you feel. So that's Greg, a number of years ago, my brother Greg, who really struggles with depression, and actually he has bipolar disorder now. And when somebody is not having depression, we talk about rose-colored glasses, right? So when it comes to facing illness or disability, when you have the rose-colored glasses on, and probably all of us do sometimes at least, we see ourselves as strong, a survivor. I'm fit, I'm sturdy, I'm capable, I'm whole, I'm good enough. But when you have depression, the crap-colored glasses come out. And you start to selectively notice the crap. And the crap can make you feel diseased, ugly, broken, defective, vulnerable, weak. So why is depression a serious concern? In addition to, it affects your quality of life because, feeling like you have no joy in life is not good. But it also has some really interesting other effects. It can affect your willingness to engage with your medical treatments. People who have depression are less likely to take their medication and follow through with the exercise regimens and do the stretching exercises you're supposed to do, or whatever long list of things that you could do to manage your Nail Patella syndrome better. It also can affect your immunological functioning. You're more likely to have functional disability. So things that bother you will hurt more, suffer more, you'll be impaired more by if you have depression. Also people who have depression are also at greater risk for mortality, all-cause mortality, not related to suicide. So what are the symptoms? I'm just going to cover them real briefly. It's depressed mood or a lack of pleasure. So depressed mood or a lack of pleasure. And what lack of pleasure is really, one of my patients described it as my give-a-damn is broken. So it's really hard to care. Nothing really seems to interest you or give you any joy. It's persistent, so it lasts most of the day, more days than not. A lot of times teens and men and older adults will report irritability more than they will sadness. And things that you used to enjoy just don't seem to have it for you anymore. Feeling of worthlessness or excess guilt. This is feeling bad about yourself, not just bad about something that happened. So I say when I'm working with people with diabetes, I said, this is not feeling bad that you ate that piece of cake. This is feeling like you're a bad person because you ate that piece of cake. It's inappropriate, it's disproportionate, or you feel really not worth the effort that all of this stuff requires. Diminished ability to concentrate. That's when you might find yourself reading and you can't even get all the way down at the page before you have to start over. Or difficulty making decisions. You really find that you just can't make a decision. Thoughts of dying or suicidal ideation. This is not fear of dying. This is it may involve fantasies of dying, or it actually might involve planning. And it's a symptom of depression. And just like the other symptoms, when you treat it, it gets better. So that's what I really try to reassure you. If you have depression and you're having suicidal thoughts, suicide is a permanent solution to a temporary problem. When you get treatment for depression, it is treatable. That goes away. And that feeling of hopelessness and helplessness. Hopelessness is that feeling like there's no light at the end of the tunnel. And helplessness is that feeling of why bother, because nothing works anyway. And there's physical symptoms, like physical slowing. You might feel like you're, like walking through sand. You just can't seem to get going. Changes in sleep, and we see the full spectrum of changes in sleep. People sometimes report that they can't get out of bed, and other people say that they can't get to sleep. So we really see the full spectrum. Changes in appetite, I think with Nail Patella Syndrome in particular, my guess would be, in watching my family members, appetite goes down. And it can go down rather dramatically, so that people can get quite skinny when they have depression and Nail Patella Syndrome. Not that that's required, but I think changes in appetite are pretty significant symptoms, especially if you're already on the thinner side. And lack of energy, that's that feeling like no matter what you do, you just can't seem to get up and go. And in order to be a diagnosis, it has to cause a certain amount of impairment in your functioning. So if you're pushing through just fine, they wouldn't call that a disorder. So it's really when it starts to get in the way that, sort of living life becomes hard. So the last thing I have on the list about what's hard about Nail Patella Syndrome is perhaps the increased risk of ADHD, and I put a question mark after that because I think, it looks like that, but again, we're not absolutely sure yet. So in my family, and Evan, my son, has it, ADHD, inattentive type, so I can talk to you about a little bit from personal experience of having been a mom of someone who struggles with inattentive type ADHD. So there's two types, inattentive and hyperactive or impulsive. And inattentive type, I'll tell you have to have, so in order to really warrant, so it's not just a kid being a kid, there's 6 symptoms that they have to have for at least a period of 6 months. And it has to, again, affect functioning. So school is hard. Being home is hard. I mean, it really shows up in a lot of different areas and not just one thing. So there's a lot of symptoms on here, but I'm just going to paint a picture for you. So symptoms of inattention. So for Evan, it would be like he would lose his homework, like every day. He'd always forget his lunchbox. And when I was talking to him, it didn't look like he was paying attention half the time. He was really bright, so if it was boring, he couldn't do it. I mean, he really couldn't do it. It was really interesting when we first noticed this, and the reason that we had him tested for it, he was having a hard time reading. So he couldn't read the Dick and Jane books. He was struggling reading the word was, W-A-S. If I put a Dr. Seuss book in front of him that had those long whatchamacuzit words, he could read that. And I thought, how can he read whatchamacuzit and he can't read was? This ended up being why. He literally could not focus his brain on that boring stuff. So I got him science books and things like that. And it seemed weird he couldn't read Dick and Jane, but he could read the science books. So, and that was really because of inattention. So it's really interesting how these symptoms can show up, because sometimes you really can't pay attention, and it's not about will. It's not because they don't want to. Difficulty organizing yourself, he still struggles with that. Easily distracted with extraneous stimuli. I sometimes wonder if I have it, because when I'm teaching a class, if somebody starts talking, I'm like this. It's like I lose where I am, and I'm like, I can't go, okay, ignore that person over there. And so that's kind of the picture of inattentive type. A lot of times you appear to be daydreaming. Melanie said that it's like her favorite pastime is daydreaming. That's inattentive type. Now, the Tasmanian devil, that's the hyperactive impulsiveness stuff. That's fidgeting, squirming. And in adults, you can see the same thing. Really have a hard time sitting still for any length of time. And sometimes adults will say it's like they feel like they can't sit still. They may be able to, but their bodies feel restless all the time. It's real hard to sit. Often have that get up and go, talking excessively, being impulsive, so they blurt out an answer, before waiting, or they don't raise their hand, or if they raise their hand, that means I should talk already, things like that. Interrupts or intrudes on others, difficulty waiting a turn. Those are the kinds of things that have to be impulsive. When you see teenagers with ADHD, then impulsiveness, his best friend also happens to have ADHD, and the two of them really drive me nuts. They like to make gross sounds, and they try to and we'll be in the middle of a conversation, and all of a sudden one of them will go, make a fart noise or something, and the other one thinks that's hilarious. And so I'm like, you guys you're 18 now. Don't you think it's time to not do that? But it's like there's the impulsive thought is there, and they just do it. No, he doesn't do that when he's at work, but thank God. But it's funny how, that little bit of the thought is there, it comes out. So how am I doing with time? Okay.